All right, so now I am pleased to welcome Shay Hardner, Sustainability Specialist at Worthen Industries, to introduce the Building Communities session.
Hi, I'm Shay Hardner, and I support sustainability efforts at Worthen Industries. Worthen is a 150-year-old family-owned manufacturing company. We have 5 plants in the U.S., the 2 largest, including our headquarters, here in New Hampshire. We make coatings, adhesives, extruded films, and coated substrates, supplying products to a wide variety of industries, including construction, footwear and apparel, medical, transportation, and food packaging. Sustainability is important to our company. While we have been recognized for our accomplishments related to renewable energy, installing solar arrays, participating in hydronet metering, and advocating for renewable energy policies, we strive to improve sustainability throughout our company. Each of our 10 business units and our plants have just one thing projects that they are working on that address issues such as increasing energy efficiency, decreasing waste generation, and moving towards greener chemistries in the products that we manufacture. We're sponsoring this year's conference because NHR does important work, bringing together passionate and compassionate, creative and hardworking people and companies so that we can learn from and support one another as we all work towards a more sustainable future for our employees, our companies, our communities, and our planet. I'm excited to introduce our next session, Building Community Wealth and Wellbeing as an Anchor Institution, and our presenters, the team from Dartmouth-Hitchcock Health, Zach Conaway, Carolyn Isabel, and Greg Normand. Thank you so much for joining us, and I hope that you enjoy this session.
Well, welcome to Zach, Carolyn, and Greg. We're very happy to have you here with us today. I am going to stop sharing my screen, and you all are set up as co-hosts. So if you have slides, please feel free to share them. But thanks so much for joining us.
Yeah, welcome everybody. I'm Zach Conaway. I'm the Director of Environmental Services and the Environmental Sustainability Coordinator for Dartmouth-Hitchcock Health based in Lebanon, New Hampshire.
Hi everyone, my name is Carolyn Isabel. It is a real pleasure to be here with you today. I am the Director of Workforce Development at Dartmouth-Hitchcock and lead all our Dartmouth-Hitchcock Workforce Readiness Institute and the training programs offered to members of our New Hampshire and Vermont communities.
I'm Greg Normand. I'm the Director of Community Health and part of our population health team at Dartmouth-Hitchcock Health.
Great. Thank you all for introducing yourselves.
So thank you for having us here and joining us to talk a little bit about Anchor Mission and how large organizations, particularly hospitals and universities, but conceivably other businesses as well, are starting to think about how they can envision increasing equity and social well-being in New Hampshire through their everyday business practices. I'm going to run through a slideshow. I'll do much of the presenting on the slideshow portion. Carolyn and Zach will jump in at certain parts during the presentation. And then we really have some questions for all of you because, I'll just say that Dartmouth-Hitchcock as an anchor institution is really just beginning our journey on this process. There are steps that we've taken that we've advanced significantly. There are places where we really are in infant mode in terms of understanding how we can continue to be more intentional. And really, we view this as a process that nationally is really an emerging way of thinking, particularly among hospitals and universities, but more broadly as well. And so there's opportunities for really everyone to contribute to the development of these ideas. So let me just make certain we can advance slides. Great. So, in the big picture, what is an anchor institution? We have a definition of anchor mission, and really I'm going to highlight a few things here that institutions that are pursuing an anchor mission are really thinking about intentionality. So how can they intentionally design their work and design their daily business in ways that maybe they had just done that business before. It was big, it was good, it generated whatever benefits it generated, but maybe hadn't been fully examined. So anchor mission is really about how can we intentionally choose, the way that we use our place-based economic power and human capital to create mutual benefit between organizations and the communities that they're a part of. I'll come back to that intentionality concept in a moment, but really thinking about this is about using economic power as a way to be able to advance social well-being, and the thinking and the intention that goes behind that. So what does it mean to be an anchor institution? We do think that broadly for-profit businesses and other businesses can act like anchors and have anchor-like processes and practices. But from a national level, is the sort of national organization of hospitals and universities that are developing anchor institution concepts would say anchor institutions tend to be nonprofits or public institutions. And they would say that because nonprofits and public institutions derive benefits from the community through tax-exempt status, and in turn have some obligation or responsibility to give back to the communities that they're a part of. So this nonprofit concept really, draws from the standpoint that because we get benefits as nonprofits, that we have some reason to be able, that we should be engaged with our communities. Anchor institutions tend to be place-based, and they tend to have what we would call rooted or sticky capital. So when I say place-based, I mean we're here where we are and we're not going anywhere. So if you think about UNH, if you think about Dartmouth-Hitchcock, if you think about Dartmouth College, none of us are planning in the next several hundred years to relocate in Utah or to pick up and move or leave the state. We're here for the long haul. And as a result, we are sort of uniquely in a position where the community around us is integral to the success of our ability to meet our missions. We would be large economic engines. So Dartmouth-Hitchcock is the largest private employer in the state of New Hampshire, with a very large budget, certainly fits this category. Really thinking about the concept that anchors are big places. They spend a lot of money, they hire a lot of people. And really this fifth category that these are businesses that increasingly are thinking about the well-being of the business and the well-being of the community as being a synergistic process, that they're not separated from each other. It's not businesses doing well for the community, it's businesses and communities doing well together. We do think that for-profits can fit in this mold, just sort of acknowledging that nationally this anchor institution concept tends to sit in a nonprofit world. So what drives interest in anchor institutions? I think there's an increasing understanding nationally that income is a key driver of health and well-being. We took this snapshot in the greater Upper Valley region. The snapshot could be repeated in the Seacoast region. It can be repeated in Manchester and Nashua, in any part of the state of New Hampshire, really in any communities nationally, that in communities that are close to each other or in neighborhoods that you could walk to across a street, there can be significant differences in expected lifespan. And there were many, many factors that can contribute to that, but certainly there seems to be a significant income linkage between life expectancy and other sort of disease conditions and household income. And if we look at that, I mean, this is a profoundly disturbing concept. There's nothing inherently happening in Newport that reduces lifespan, nothing inherently in Hanover that increases lifespan. These are communities that are 20 minutes apart, basically are next door neighbors in the world of New Hampshire geography. So, really we should look at this and say, how is it that we can tolerate this kind of difference in lifespan and burden of disease in different geographies in our state? And along with that, we'd also really say that there's some significant income differences between white populations in the state and communities that would identify as Black or Indigenous or otherwise persons of color. So we see some significant household income variances between those groups. And, to the right, sort of a recognition that even with COVID, we saw significantly more hospitalizations among Black and Indigenous and persons of color in the state of New Hampshire. So understanding that there's this income gap, understanding that this, certainly probably has some historical and sort of long-term drivers that have resulted in this. These are sort of two key areas that we look at as anchor institutions and say, we would like to be able to contribute to changing this and closing this wealth gap, and understanding that if we do so, we have a significant opportunity to increase equitability of lifespan and disease burden across the state. Unfortunately, our tools to do that are pretty limited. So, when you look at those issues and you say poverty and racism or housing issues or environmental hazards can be significant drivers of health and well-being, then we look at what are the tools we use to address that. The thermometer on the left sort of gives a sample of how many hospitals might break down how they use their economic power. Most of it goes to paying people. A lot of it goes to paying for supplies, we buy some other things. And then that tiny little blue line up at the top, represents sort of a symbolic amount that we may put into what we think of as social programs or community programs or charitable giving or social responsibility or things of that nature. In terms of Dartmouth-Hitchcock, that's still a large amount. We make a lot of contributions and engagement with our communities. It's a sizable number, dollar value that we put into communities. But compared to the overall economic activity of the organization, it's tiny. It's a tiny fraction. So, if we're saying that poverty is a core issue driving health and well-being, we're really bringing a tiny portion of our activity, overall business activity, to be able to address that. And anchor concepts would say, how can we change how we think about that? How can we look at how we use our payroll? And how can we look at where we purchase and how we purchase as part of how we address those bigger societal challenges? How can we use the equity that we have, the endowments or the reserve funds that we have, in ways that drive economic well-being in the communities in which we're present? So a core shift in anchor thinking is moving from this tiny little line at the top where we say we have a budget that we call our charitable giving budget or a social responsibility budget or our community benefit budget, to really becoming more intentional in saying, we hire 2,000 people a year, and a lot of them are in frontline positions. We have a huge opportunity to impact those variations in income across the state by thinking more intentionally about who we hire and how we help them to gain access to jobs in our system. How we help them to gain access to career path jobs that allow their income to grow over years and allow them to accumulate greater wealth as they proceed in their career. With our supply purchases, we have the opportunity to say, what is it that we could be purchasing from local businesses who hire people who live in our communities, and again, can advance the health and well-being of their employees through expanding their businesses. And from a standpoint of how we think about our investment pools, do we bring our money to Wall Street, invest it in investment firms for whatever return we can get there? Or do we think about how we can bring those dollars back to New Hampshire and say, what are similar kind of investments we could make here that result in more housing, improved childcare facilities, services that would benefit populations and communities where we live? So this is really this key shift from saying doing well for our communities is not this tiny little portion at the top. It is everything we do. And how can we build this into our DNA so that when we make decisions about our entire economic power, instead of bringing $1 million a year, we can be thinking about how we're using $2 billion a year to address these issues. Oops. And broadly, I'd say nationally, there are a couple of, 4 key areas that people are talking about being able to use this economic power. Key to this work is who we hire and how we help them advance in their career. Can we build jobs that, with the intent that every job we hire for has a career pathway that advances people in terms of their income and well-being? Are we as an institution raising our wage floor to be able to ensure that people who work here can live in the communities where we work? Can we reach out to communities that historically haven't seen themselves as part of a healthcare industry and jobs, and invite them to come work for us and help them through whatever immediate challenges might be preventing that? Similarly with our supply chain, what kind of foods do we serve in our cafeteria and do we serve to our patients? We serve a lot of food. With our supply chain, how can we signal so that, send out advanced signals so that businesses in New Hampshire can respond to the supply needs that we have? And how can we increasingly identify and reach out to businesses that are owned by women and Black, Indigenous, or other persons of color owners, and make certain that we're communicating what kind of business needs, what kind of supply needs we have, and inviting them again to become bidders and vendors in our supply chain? How can we think about our environmental sustainability in ways so that we reduce the toxic impact of the kind of business that we run on the communities around us? How can we advance multiple systems in our community that reduce our carbon footprint, reduce toxic waste? And can we be thinking about investing in community development finance institutions within the state of New Hampshire, or thinking about reserving some percentage of our investment portfolio to specifically be brought to in-state investments rather than out-of-state investments? And just some examples I'll give you locally and nationally. The Anchors in Resilient Communities food processing work out in the Bay Area in California. Multiple anchor institutions, Kaiser Permanente, some of the university systems said, we purchase and we use a lot of food, and we live in an agricultural valley, but we get our food from national food vendors. So what would it take for us to increase the amount of food we purchase locally? The response to that was there needs to be a local cooperatively owned food processing plant. And those anchor institutions used some of their capital investments to attract other financing that was used to be able to build this food processing plant. That building that plant and operating results in local jobs. That plant is owned by community members and farmers in the region who make certain that that plant is processing food that's grown locally. So it's building markets for local producers, it's building jobs for residents, and it's bringing food from local vendors into those anchor institutions. Carolyn's going to talk just a little bit about Dartmouth-Hitchcock's Workforce Readiness Institute and how it's sort of engaging entry into our workforce from folks who may not otherwise have found us.
Thanks, Greg. We started our Workforce Readiness Institute about 6 years ago, and at that time it was really about helping people who are interested in pursuing a career in healthcare obtain that foundational skill set that leads to a national certification or licensure and a full-time role within our health system. Over the last 6 years, our thought process has really evolved, and as we think about how we support people that are taking that step into healthcare, we're really looking for people who have an aptitude and a willingness to learn, that are committed to helping others, and that can really see themselves growing within our organization. We feel very strongly that we can teach the technical skills that we need to help someone get started, but we also spend a lot of time really working on the soft skills and the professional skills needed to be successful long term. In the last year or two, I think we've taken a second significant step and are really focusing on those career paths, and for the people that have joined our organization, how they can take that second step, either through continued education or kind of upskilling, any type of continued knowledge and skill development that allows them to be promoted into a higher level role, increase their wages, and again, really prolong their career with our health system. Over the last 6 years, we have worked with, I would say, between 800 and 1,000 individuals, and really helped to set them on a path to success.
Great, thanks, Carolyn. I'll also just give as an example some of the work that's being done in Cleveland. This is one of the earlier anchor institution collaboratives between multiple hospitals and universities, who originally started and said, you know, we use a lot of laundry. We operate hospitals. We have, you know, laundry coming from our beds all the time. Recognizing that these hospitals were located right in the middle of some of the lowest income communities in Cleveland. They decided that what they could do is to help start a worker-owned cooperative laundry. So they invested capital funds from anchor organizations. They attracted funds from private foundations to help support the development of a large laundry business, which now has been in operation for about 10 years. It's worker-owned, so people who've been hired from these neighborhoods out of sort of very extreme poverty in certain parts of Cleveland have moved from being, I'd say, consumers of jobs to being owners of their own business. And they have consistent supply chain needs because these hospitals and universities have made long-term commitments to purchase through this local business. And then in turn have expanded this cooperative to include a growing cooperative to feed patients and students in these anchors, and to work with the anchors to develop sustainable solar solutions. So it's really been an innovative process of ensuring that people from very low income neighborhoods in Cleveland have been given access to jobs, and then rapidly moved from being sort of lower income and low wealth individuals to increasingly becoming business owners and managers of their own wealth and capital. And in doing so, by having it be owned by the workers who are there, these businesses are extremely unlikely to ever relocate because it would require, you know, all of their worker owners to choose to do that. Zach, do you want to talk about our pharmacy garden?
Sure. One of the examples that we've used at Dartmouth Hitchcock at the medical center in Lebanon is the pharmacy garden, in which, from a sustainability standpoint, we're using unused land on our property to grow vegetables seasonally to give back to our communities to help promote healthy diets and healthy eating habits. And so what we've done over the last 3 years with our pharmacy garden is helped to expand that out and work with a local nonprofit out of Norwich, Vermont, called Willing Hands, in which we're providing those vegetables that we grow back into the community and going to other nonprofits that they distribute to throughout the Upper Valley, including the Listen Center and the Haven here in Lebanon. It's a really great way to continue to use unused areas of our property and be able to use it for our community.
And finally, I just give the example. Of using endowments, capital reserves, sort of other reserve funds that businesses might have to think about where those can be invested while we're waiting to use them for other uses. Certainly, I'll say that Dartmouth Hitchcock has done this in the last year, but multiple other New Hampshire businesses and a couple of hospitals have done this as well, of looking to New Hampshire and saying that there are investment opportunities at organizations like the New Hampshire Community Loan Fund, which is a community developed finance institute, is structured, and their business purpose is to help reinvest dollars in affordable housing and childcare and other fundamental community services that all of us as businesses would like to see. This project in particular the New Hampshire Community Loan Fund is known for their investment and development of resident-owned cooperatives, where people living in mobile homes are organized to buy the property that their mobile homes are on, and to form cooperative ownership groups so that they become owners and not just renters. So, in this case, last fall, Dartmouth Hitchcock made a $3 million loan to the New Hampshire Community Loan Fund at a somewhat below market rate, as a way of using a portion of our investable assets to drive those back into the well-being of people in New Hampshire. So I think these are multiple different examples, some locally, some nationally, of ways that anchor institutions have been rethinking how they do business. I think that core shift being, how can we think about every part of our economic activity as being something that we can intentionally choose to do use in new and different ways, in ways that benefit us as organizations. Dartmouth Hitchcock needs to have housing for people who work here. So does every other business. So driving our investment pool, maybe at somewhat below the rate that we would get from a Wall Street investment into the Community Loan Fund, is a way of preserving affordable housing that may be used by our employees or may be used by employees of other businesses, but it's essential to maintaining the sustainability of our economic well-being in the state, and in sustaining economic well-being, sustaining the health of our residents. And I think all of our anchor strategies really kind of fit that model. So we're going to stop presenting and just put a couple of questions up for you.
Greg, there was one question in the chat for you. It said, has DH collaborated with Howard Brodsky about creating cooperatives for DH communities and people's needs? Just before we jump into the next part.
I'm not familiar specifically with Howard Brodsky, so it would be great to hear more information about that. Like I said at the beginning, we're very early on our journey in this kind of anchor world. So, we're looking at multiple different ways of being able to engage with projects that support the development of new and affordable housing. One of those first forays really was making an initial investment in the Community Loan Fund. I know there are multiple other conversations that we're having, so I think any conversations in this space would be of interest to us. So let me put questions broadly. I think these questions are really broadly for everybody who's in the room with us. What is it that we're already doing that aligns with these kind of concepts? What opportunities do we see? How could we start to build these in small ways and big ways into our businesses? And how could we collectively collaborate to advance some of these ways more powerfully than any of us can do individually?
I think when thinking about the anchor strategies, that, regardless of whether we actually label ourselves as an anchor institution or not, we are. And all of our decisions really impact the communities around us. So I think the intentionality that the anchor mission brings is really just changing our decision-making framework to take the community and really generating positive impacts through our operations any way that we possibly can. And I think that is applicable, kind of large or small, across any industry, that we all have the ability to really switch our thinking about how we operate.
I'm wondering if you would mind sharing just maybe some of the lessons that you've learned as you've started this journey within DH that might be helpful for others in the audience as they consider these questions, and also to bring the idea back to their businesses.
We're all looking at each other.
I know, I'm like, you guys know me, I'm always happy to start.
Go ahead, Carolyn.
I think, and I'm going to speak from a workforce and training perspective, As we've went out and really sought candidates to bring into the healthcare industry, we structured our programs in a way that where we tried initially to remove just about every barrier that we could. And what we learned quickly is that we are better off to provide kind of supports and coaching and connections, really empowering trainees to own their own success. And just really kind of helping to teach them all of the different skills that they need for long-term success. I think that the second thing on the training front that we really learned is that the first step in, so providing that initial foundational skill set is wonderful, but it's not enough and you can't stop there. So really thinking about how we can put different supports in place and tailoring those supports to what our employees need to help them progress along that career path. And I'll just share one really distinct example with the nursing career path. So we have licensed nurse assistants, licensed practical nurses, and registered nurses in our workforce. And taking those steps through continued education is available here, which is wonderful. When we were starting to think about how to support our nurse assistants going back to school, one of the things they shared is that the cost of daycare when managing a full-time work schedule and a full-time school schedule is very expensive. All of a sudden you go from needing childcare 3 days a week to needing childcare 5 or 6 days a week. And I think that we all recognize that there's a shortage of childcare in the first place, so that's hard. So we were looking at ways to provide some paid learning time so that they could cut back their hours but not drop their income and still balance going to school. So I think it's just being really creative and thinking about, what can we offer that actually helps them to balance and take the step forward.
And I would just add to that, Michelle, I think one of the things that we did early on was we convened people from human resources, from sustainability, from purchasing, and from investing all in the same room. And we started by saying, what are we already doing that fits this profile? And as we began to identify what it is we were already doing and already being successful at, that gave us an opportunity to ask the question of how could we take the next step? How could we make this one small step better than what we were already doing? And through the course of those conversations, we were able to build a shared platform of recommendations that since has been advanced through senior leadership of Dartmouth Hitchcock. And I think there's been real power in tying those different efforts together. So, Zach has always been working on ways to be able to reduce energy use, reduce waste, lower toxic impact on communities. Carolyn has always been hiring people and trying to figure out how to get them into roles. But there's a unique power in terms of joining those goals and saying, if we're going to be an anchor institution, we need to, and here are our 10 recommendations, putting them all in the same place and being able to present them to leaders and sort of discuss them from a standpoint of gaining endorsement about the concept, and a concept that becomes an umbrella for multiple of these sort of sustainability and anchor concepts.
Thank you, Greg. This is Melissa. Mike Appleberg from United Way has a question, or wanted to contribute to the discussion questions, one or the other.
Hey, Melissa, thanks for calling on me. I appreciate that. This is a really great conversation. I do appreciate it. The idea of being an anchor institution or being a collaborative partner is kind of core in our DNA at United Way. So I can really appreciate where this is coming from. I would say a few areas where this type of an approach in our state, I think, is really important from where I sit. Youth homelessness is one of those intractable kind of issues that we work on, other partners around the state work on. We have multiple continuums of care around the state with lots of different partners at the table. So that's one area that I would ask people to consider sort of some participation and getting involved and jumping in. The other is really statewide advocacy. So I think it's important for all of us to support organizations, just as for example, Housing Action New Hampshire. When we look at intractable issues like housing in the state, we really need strong voices in the State House that are advocating for these issues. And housing is one of those that's come up a couple times, super complex, and having supporting an anchor organization like Housing Action New Hampshire, I think is very important as well. I don't know if that helps contribute to the conversation, but I certainly appreciate it. Thank you, Melissa.
From Hypertherm. You know, it's funny. So obviously, you guys know we're doing some great things in our communities wherever they are, and I think sometimes the thing that might hold us back, and I wondered if others feel this way, is, and I'm sure you guys have struggled with this, is you can't do everything for everyone in every community, right? So we struggle with fairness and equity and wanting to make sure that we're being mindful of that, but then it keeps you from moving forward, right? So, you know, we have our machine operator program that we feel really good about, and, you know, digging into that, and now we've broadened that to our assemblers, but there's still so many opportunities throughout the company, but people live within an hour and a half in any direction, right? So there's housing in an hour and a half in any direction. There's transportation in an hour and a half in any direction. And I'm just talking about our New Hampshire people. Forget about the Minnesota and the Washington State and the people around the world, because this is New Hampshire focus. But how do you guys handle that? That you can't be doing what you're doing in every single community for every type of employee, and, you know, so.
It's hard. It is, that equity question comes back over and over and over again. And then it's that balance between either doing nothing or doing something for some. And I think kind of wrestling to a point where you get to a place where you can talk about it and say, here's what we're going to do and can do now. Because I think I agree 100%. It can be totally stalling and debilitating, right? Because you can get completely stuck on that point and not be able to shift past it. But I think really, you know, looking at it from, you know, what are our desired outcomes? What are we trying to affect or influence? And then how do we put a stake in the ground and feel strongly about the, you know, even if we can communicate in increments, that it is better to do something than to do nothing. But it is hard.
Thanks, Carolyn.
We had a really lengthy, you know, it was actually, I think, probably a 2.5 hour meeting of our anchor leadership team focusing on the question of what's local when you're a big organization that has, you know, outposts around the state. We really sort of recognized that there were multiple different circles of how we would define local as you know, as Dartmouth Hitchcock Health. So obviously we have, you know, a main campus academic medical center in Lebanon, and that's the largest part of our enterprise. And so we certainly have a lens which is about sort of the Lebanon, Claremont, Hanover, Windsor, Norwich area. But we also have operations around the state of New Hampshire and Vermont. So another lens that we can look at is to say, really, we're local for us is New Hampshire and Vermont. And then, you know, our supply chain folks and our you know, our food and nutrition services said, you know, the food shed that we draw from is a little bigger than that. So for some of the ways that we think about local, we need to define, you know, that a little bit more broadly than just 2 states. And I think we constantly toggle back and forth between, you know, are we talking about anchor decisions for kind of the hyper-local Lebanon-centric campus area compared to, are we trying to broadly benefit you know, the communities and community members in New Hampshire, or more broadly. But it's been helpful to sort of acknowledge the fact that we have these multiple geographies that we would define as local.
We do have a couple of questions in the chat too, and we've only got a couple minutes left, so it might just be one of you that has to answer, but I want to share them. Mikey asks, Prosciutto from Scrap asks, what was the tipping point or light bulb moment for all of you at DH when you decided to pursue these programs and operate as an anchor institution?
I'm not certain if there was a light. I mean, so, you know, we had multiple staff members who went to national there's a national anchor network for healthcare organizations. Certainly attending that, understanding how other thought leaders in the hospital, university realm have been working was a motivator for us.
Okay.
I think the ideas have been in various different forms in latent or various stages of development. But participating in that national network has kind of galvanized us to look at this as a whole.
So maybe you'll create the ripple amongst this group. Another question from Jay Childs. Carolyn, could you expand on the role of an employer such as yourself for roll up your sleeves advocacy for issues and policies in the community to support these anchor strategies?
Sure. I think there's a lot of ways that we try to tackle this. We try to spread our resources out and have a voice on different boards, committees across the state. So both at the state level, at the academic level, so being on and partnering with the community college system and the different universities, really just trying to have a seat at the table and to be able to influence some of the decisions where they're being made. We also have a team through our government relations office, and they are looking at issues at both the state and federal level and advocating on behalf of Dartmouth-Hitchcock Health. And they work closely with the subject matter experts within our teams, really making sure that they are understanding our position, what barriers are there, where we need to see change, and helping us push for progress. So, but it takes I think there are different levels of advocacy, and it's really important to have a seat at the table on as many teams, committees, boards that we possibly can.
Well, I want to echo too what Jay mentioned last in the chat, was that I think legislators, especially in Concord, listen to businesses. And so you have a very big voice to share. And for us in testifying against House Bill 544 being in the budget, it was great to have Dartmouth-Hitchcock at the top of that list as the largest employer in the state. So I love having all of you speaking out and raising your voice in support or opposition of various things. So, well, we are at 11:15, so I want to thank Zach, Carolyn, and Greg for sharing this, and I hope it is certainly inspiring to see what you've done, and I hope everyone will take these questions back to your organizations and think about what role you can play. So thank the three of you very much for participating today.
Thank you all.
Thank you all.